Reagan Robertson here with Productive Dentist Academy. Get ready to join your favorite podcast hosts, Dr. Bruce B. Baird, Victoria Peterson, Dr. Chad Johnson, and myself, Reagan Robertson, at the nation's #1 dental business course that guarantees practice growth. That's right. Full immersion CE, so you can consistently produce more and align your team for results without compromising excellent patient care. Productive Dentist Academy has a special running this month that you can activate immediately. It's called the PDA Productivity Bundle. And we put this together so that you could attend this workshop, which is happening September 22nd to the 24th in Frisco, Texas at the Hyatt Regency, along with tools to make sure that not only are you getting great education on how to increase your productivity, how to communicate better with your team and your patients, increase your case acceptance, authentic market practice, and more, you also get a 2-hour business advisory session before the workshop to really get clear on what matters to you most so that you can be set up for success at the workshop. And following the workshop, you get 12 months access to PDA on demand. That is the entire productivity workshop on demand for you to make sure that you are doing everything you can in your power to soak up all of that CE and implement it come Monday morning, the next month, and the next month, and the next month for 12 months down the line. Registration is now open. The tuition cost is $2,195, which is ridiculous because it's regularly $5,528 for the productivity workshop attendance, 2-hour business advisory session, and 12 months access to PDA on demand. Hop on over right now to www.productivedentist.com/workshop to grab your registration today. Again, that is www.productivedentist.com/workshop. If you cannot wait and you have to have it right now, email Brent, B-R-E-N-T, at productivedentist.com. That's Brent, B-R-E-N-T, at productivedentist.com, and we will save you a seat. I look forward to seeing you there. Welcome back to Everyday Practices Dental Podcast. Today, we're rejoining the conversation Dr. Chad Johnson and I had with CariFree founder Dr. Kim Kutsch. In our last episode, I promised we would geek out about all the science details about preventing dental caries, and we are ready to delight you. We also have a great conversation about how you can leverage the patients you've helped to spread the word about your practice. Nothing beats guerrilla marketing. So let's jump into today's episode of Everyday Practices Dental Podcast.
So anyway, that's
so I have a couple nerd questions.
Yeah,
number one, the FDA, from what I understand, the FDA, you laugh as soon as I say the FDA. Okay, so the FDA.
We might have to edit this part out.
I was gonna say that was such.
Oh, the FDA is my life, you know. So
the bane of your existence.
No, I wouldn't necessarily say. I mean, there are days I feel that way, but no, they've been.
So here's my question.
Go ahead, shoot.
The 10 milliliter suggested, rinse or whatever for the CTX4 is 10 milliliters. Effectively necessary, or what I tell patients, and tell me if I'm wrong or if you would modify it, one way or the other. I tell them, listen, they have to have a certain unit of measurement, and there's probably a minimal measurement. I think, you take a wad of spit and you've got 2 milliliters. You don't need to do 10 milliliters at a time. And then therefore you can make that bottle last 5 times longer by using 2 milliliters more often than using 10 milliliters and trying to use it like gold once a day or every other day.
Yeah. That's an interesting question that you asked, Chad. And I would say that hasn't been studied.
No. Nor could it, I'm sure, but other than
you probably could study it. Most of the studies that have been done on certainly on sodium hypochlorite as a rinse have involved frequency of use and percentage of sodium hypochlorite in the solution, not really, and maybe how frequently they use it during the week, and not really looking at, is 5 milliliters as effective as 10? Is 2 milliliters effective?
What would be your guess?
I would say 10 milliliters is optimum. I would tell patients you could certainly probably get by with 5. And look at this. I tell patients that if it burns and you can't tolerate it, dilute it half and half with water. So take
Sure.
5 mils and add 5 mils of plain water, because that's still better than not having it at all. So any use of that as a antimicrobial agent, if that's appropriate for that patient, any use of it all is better than no use, right?
Sure.
So it might take longer, Chad, to convert their biofilm. Instead of 6 months, it might take 12. I mean, it might take longer, but I think you can achieve an outcome with that, that way. It was interesting. We did a clinical trial back in 2008 through 2010 in Townsville, Australia. We never got to really publish this data because our results were so far outlier in terms of success that journals were afraid to, I mean, literally people were afraid to publish it. But it was a really well done, great people that conducted the study. They, Carrot Hallett, he's now, chief dental officer, in one of the provinces in Australia. We took these 2 grade schools that were high risk for dental caries. On average, Townsville is a non-fluoridated rural kind of communities in Queensland. And so here's these kids that are averaging 2 new cavities per school year per kid. And so all we did was treatment rinse, supervised rinse for 30 seconds, 4 times a week. They were in school just 4 days a week, 9 months out of the year. There was nothing else. We didn't teach them anything else. There was no counseling. There was nothing. All we did was just have them use the rinse at school. And then we had them, the control group, certainly you can't take those kids that have disease and not offer them some treatment. You can't just give them water, because that'd be unethical. So we gave them just a standard 0.05% fluoride rinse. And the outcome was that the standard rinse reduced their caries by about 30%, which is pretty standard for most of your fluoride studies, in children. And we extrapolate that data to adults, but whether it's fluoride toothpaste or fluoride rinse or whatever it is, most of the data I can cite, it all falls in that 28 to 32% kind of range. The CDC says that I think the prevented fraction of cavities on primary teeth is 28%. On permanent teeth, it's only 12%. But on the wing, the test wing that we did with the treatment rinse, reduced their decay rate by 73%. And then on top of that, it continued to improve. Like, see, when I first started using we developed the CTX4 rinse, I figured it was like a 30-day treatment, or maybe 3 months, or, maybe at the most 6 months. Those kids continued to improve for 2 years. And that was a real mindset change for me, that this wasn't a kind of a, take one pill, you're cured.
Yes.
It was like, this was a 2-year process. Now, we did the study for 3 years. There was no additional improvement between 2 years and 3 years, but there was continued improvement for 2 years. And so that, in my mind, really changed the concept, for me, of like changing biofilms. This is along with their behaviors, this is a long-term kind of proposition. It's not an overnight thing. So when you start talking about, well, it's 2 milliliters, you can stretch the bottle out. Yeah, you can do that. Think about this might, for the patient, this might be something that this might take us a couple of years to get this completely turned around.
That's what I learned at COIS too, because, at first you guys were selling these little bottles.
Yeah.
And I was trying to push the info up, to reach to you.
Yeah.
Or someone that is just like, listen, I want gallons, I want liter stuff, and so you guys finally give the AB pumps.
Right.
And I've been using that at home, and I've been using it twice a day. And I'm trying to think if it was February. So I'm 4 months in,
right,
of using that. And that's been really good.
Yeah. And I would say I have patients ask, well, can I just use this like every day for the rest of my life? And it's like, well, there's no reason you can't. Sodium hypochlorite has no adverse effects. It doesn't, create any persisters. I mean, there's no downside to do that if you want to, right?
And it helps with not just perio, but caries as well.
Oh,
is what you're saying? See, because I've been having CTX3 for the caries patients, but so how do you distinguish between using CTX4 or CTX3?
So what I do If
Come
you're
on
using
now.
if you're using it for perio, you're using it off label. Let me say that, which
Right.
you have the ability to do, as do
Sure.
I as a practitioner. As a manufacturer, because I don't have FDA marketing clearance for that, I can't promote or tell you to do that, right?
Got it. But Coy
So
says too, let's just say, let's
Joyce
throw
can
him
say
under the
whatever.
bus.
Yeah, well, John can say whatever he wants, right?
Right. So let's just throw him under the bus and say that there are leaders that say to use it for perio, and I've had good results.
Yeah. Oh, well, if you look at the research, I mean, Jorgen Slotz has done most of that clinical work. It's better than anything else that you can, cite results on in terms of outcomes for periodontal. So, but for dental caries, it's also, I can't even cite the next best study that's ever been done that had data was 40% reduction in dental caries rate on it was the exact study on xylitol where they gave them xylitol mints. However, it was when they did secondary analysis on their own data, which the original data on the entire subject group showed no outcome. But when they handpicked out just the people that had class 5 lesions, just root decay, those 5 xylitol mints a day, that was the entire treatment, 5 xylitol mints a day, no education, no counseling, nothing else, 5 xylitol mints a day, reduce the decay rate in that group by 40%. And that's the second highest outcome that I can cite in dental caries. So, when we start talking about, the outcomes in dental caries, I, have a really strong confidence. The way that I use it is I use the ATP, bioluminescence meter. If they have a highly active or a high bacterial load, microbial load in the mouth, along with the lesions with dental caries, then I'm going to use an antimicrobial strategy, and mine would be the CTX4 rinse. If they don't have, like if they have a low ATP score, well, they don't really have a biofilm issue. Maybe they don't have enough saliva, or they've got a dry mouth, or maybe they're eating too much sugar, but it's not necessarily a biofilm issue. So I'm not going to put them on an antimicrobial agent. It's like if you've got a viral infection, it doesn't do any good to put you on an antibiotic, right?
Right.
Now, an antiviral works, right? But so that's kind of how I look at that. That's something else I was going to tell you about. And so we listened, Chad. We heard you, and there are larger bottles coming out just in the new packaging, both for the tubes and the bottles. We're in the process of, that's been a 6-year journey, but we're in the process right now of manufacturing those and releasing things in the next 30 days.
I think if anything, just for dentist dispensation. I mean, when I want to dispense it, I don't want to put out Listerine, but this kind of stuff I believe in. So
yeah, and certainly the pre-rinse, the AB pre-rinse, in the 16-ounce bottles, certainly that's what I had in my practice, or would have in my practice today, to dispense, right? And to hand out to the patients. I can't tell you how big the new bottles are off the top of my head, but they're like 50% larger. So they'll easily last a month. The one thing I was going to tell you, and this was a study that I think I passed on, I think it was published like 2 years ago, like in 2020, but it was a study involving fluoride, standard 1100 part per million fluoride toothpaste. And they were looking at fluoride retention in both the saliva and in the biofilm after you brush your teeth with fluoride toothpaste. And what they found was that it was dose related, and the optimum dose of your standard off the shelf 1100 part per million fluoridated dentifrice was 2 centimeters. It literally filled the brush with toothpaste, and it made a difference in the fluoride retention and outcome. So I'm always
what's funny is centimeter, that's not exactly a volume measurement.
No, but as you squeeze out the tube, they measured it linearly.
Yeah.
But it was but that's how they measured it in the study. But it did make it, it was dose related in terms of for the fluoride.
So Aquafresh wins the day, huh? The old swirl swoop.
But so anyway, I'd always tell patients, the CTX4, 5,000 part per million gel, you only need to use like a pea size on your brush, and I still advocate that. And then that tube should last you a month. If you're using it a couple times a day, you should get a month out of that.
Oh yeah.
But the one thing that Brian, I love from Brian Novi is, leave the foam alone. Like, so when you're done at night, instead of
Don't
rinsing your
rinse
mouth
it.
out, if you rinse your mouth out after you use the 5,000, you just reduce the effectiveness down to an 1,100 part per million
Yes.
gel, right?
Oh,
And
at
so,
least it's something.
yeah, well, yeah,
I
but
didn't know that. And I don't mean that as the point, but like it doesn't rinse it to zero. That's interesting. Because
yeah,
I normally tell people, I mean, you just washed the medicine that you just purposely put on your teeth off.
yeah. So,
Right.
and so his comment, I mean, his phrase is leave the foam alone. And I'm like, that's a great phrase. Um, at night, last thing you do is brush, spit, and don't rinse. Just leave it alone and leave that on your teeth. And yeah, I think that's a great catchphrase for people to, they can remember that. It's kind of sticky and viral.
All
And
right.
So, so
Oh, go
as
ahead, Reagan.
as a patient, well, my mind has been blown this whole time. And Dr. Kutsch, you were
Mine
like,
too.
oh, I know. It's like seeing a celebrity in person, you and Dr. Kois. No, it really is. It's really true because as a patient, I've been in the experience where I have the comprehensive healthcare, where the doctor has the time and the communication ability to explain what's going on underneath the surface. The reason I'm wearing a Kois deprogrammer today, it was a journey for me. Thankfully, Dr. Wade Kiefer, who's heavily involved in Kois,
oh yeah,
talks to me in addition to my own doctor, Dr. Gray, who is a Kois doctor. And it took me a while to understand what they were trying to explain to me, because I thought, well, I have this grinding issue going on. And one doctor previously had told me that he could build back this tooth kind of that started to wear down a little bit, but he wasn't going to do it because I would just break it off again. And the conversation ended there. Like there was no, why are we grinding it down? What is causing this issue? And so
right.
I'm thrilled to be on this journey, and where I'm super passionate about it is how to get this information into patients' hands and onboarded. And having the Why Me book is an exceptional tool. Like dentists can go out, they can buy it, and they can hand it out. I think, Chad, to your testament too, having the rinse and talking about the rinse, like not just having it in the bathroom or whatever, but doing it during the appointment and explaining it. That's another great reason, or a great way for people to learn. What other ways have you seen from a marketing perspective, and a communication perspective that successful doctors that have CariFree in the practice are doing to get the word out?
Oh, I think it's really. I don't know that people are marketing it heavily, right? Um, I think it's. That's a really interesting question, Reagan. And I would say, I just look at the company itself, and for years we tracked where our new dental offices came from. How did they hear about us? And then and now it's gotten to the point, it's grown so organically that it's like people don't even know. They call it, well, I don't know where I heard about it, but I keep hearing about it, so I wanted to order it. And patients will like, it's just growing. I wouldn't say it's gone viral yet. I would love to have that happen, but it's growing organically from the standpoint of like they read a review or something. They have no idea. They just, suddenly we have all these new customers that we're having a hard time trying to identify, well, where they come from. And I think that one of the things that happens in a practice, now this happened in my practice, I can tell you that when you take somebody who has chronic decay, and they've had it for a very long time, and there's so much baggage and shame associated with cavities. I mean, and ugly
Sure.
teeth with holes in them. Um, Reagan, I'll talk to you about why I'm going through what I'm going through at the moment, but which I didn't really appreciate. But once you take one of those patients and you get them decay free, and then you go on to restore and give them a beautiful smile, which lasts, which, I mean, I've got 16-year follow-ups on patients that I've restored that, and if you look at the before, and they've been decay free for 16 years, and the dentistry is held up and it's beautiful, right? And those patients become evangelists for your practice. I mean, it's like, they're like recommending you word of mouth on steroids. And the thing is, they know who all the people are who are like them. They either have dental fear, or they've suffered with dental caries like their entire life, and they're embarrassed by their smile. I mean, they know who those people are, and they tell them, oh, oh, you've got to go see this dentist, right? You've got to go to this place because this person can help you. Look at me, right? And it's like they can help you. And suddenly you get inundated with these people that have all this disease. I mean, I literally I didn't think that much disease existed in my community, and suddenly these people all started coming to me, and they were all referred by patients that I had helped. And so you continue. I mean, I didn't really actively do any marketing. It was my patients that, did the marketing for me. And that word of mouth, that endorsement, that referral, still your strongest source of best new patient source that you can get. They already come in knowing what you did for somebody else, and they want that, right? And so it's not a matter of you having to say, okay, so let's go through this and let's,
It's
and talk about that.
where my passion comes from definitely is on the clinical side for communicating the value out, because I'm privately texting Chad during our interview right now. I'm telling everybody listening, and I'm like, is CTX4 for kids? Can I give this to kids? I am a CariFree customer. I use the AB rinse. So, and
Yeah.
he's like, yes. And I was like, oh my gosh, I've got it. Because I have worked so hard with my own children to explain to them, if you're doing your brushing habits, if you're practicing good hygiene and you still get a cavity, there's other factors that are at play. So
Something
don't feel
else going
bad
on.
about it. Let's just talk about it with your dentist, and we'll figure out what kind of the
Yeah.
underlying issue may
I
be.
probably wouldn't give it to some child under the age of 6.
Well, my kids are older than that.
Yeah. No, I know, but I mean, if we were recommending it for people,
Yeah.
I probably wouldn't give it to some kid younger than 6. But certainly in that mixed dentition stage, there's no reason they can't use it, right? I mean, absolutely. Um, yeah, it's interesting. Just getting back to, like, there may be something else going on. 70% of all Americans take at least one prescription medication per day, and this is all age demographics down to age 6 months. And we've diagnosed like 48% of our infants have GERD today. Of course, now they can't even get baby formula, so I don't know what they're giving these kids, but
Right.
instead. But the dry mouth situation is, in this, because of the medications that people are taking, even, I mean, on young children, and then all the psychotropic drugs we've got our children on. It just,
Oh,
we got 17 million adolescents under the age of 17 on taking psychotropic drugs.
yeah.
And for for ADHD or ADHD, I'm sorry, and anxiety and depression, and and you got the bullying going on the internet, and you got all this stuff going on, and it's like, I've got grandkids, and what a confusing time to be a kid.
Right.
You used to worry about playing baseball after school, and now it's like you got to use the right pronouns, and you got to do this, and you got to do that, and it's like, Jesus, where does it stop? And then you go home
Right.
and you get on the internet, and people are, I don't know. It's just, and then you got all the drugs, in the environment. You got all this fentanyl coming in the country. Such a, and then we're putting these kids on these drugs, right? So
Right.
I just, I worry. I mean, I guess that's all I can say.
Sure.
But when I started the CariFree movement with Doug back in 2000, and I have to laugh at myself because I told John Featherstone at the time, I said, John, give me 10 years and we'll knock the bastard off. I mean, to quote Sir Edmund Hillary, uh, he was a Kiwi, obviously, and so was John Featherstone. I said, John, just give me 10 years and we'll knock the bastard off. And well, okay, that was 12 years ago, and we're losing the battle. Like, there's more decay today than there was 10 years ago, right? And we figured out how to work through and have success, but in the bigger, so I'm winning my battle on my battlefield in my practice, but the war itself, we're losing, right? And so there's more decay, there's more people on medications, we're eating more sugar, although actually the sugar consumption in the United States has gone down slightly, finally. But
Hmm.
when you look at that, I don't know how to fix that. I mean, I literally, I don't know how to fix that.
Education. It's because it has to be holistic in the way that you live your life. It has to be educational. I mean, down to the food that our schools are serving, to how we
Right.
think about healthcare. I think it gets into a much larger conversation, which is
Yeah.
healthcare
Yeah.
et al. I mean,
Yeah.
the
And just
totality of it.
diet, nutrition, and all of that. And you've got people like Rob Lustig, bless his heart, out there championing, against sugar, trying to improve the American diet. because you look at all of the other systemic associated diseases, heart disease, obesity, um, hypertension, cancer. I mean, you go down the list of all these other, associated diseases from that nutrition, aside from just getting
Yeah.
cavities in your teeth. Um, I was going to share with you, Reagan. So I have, Invisalign in right at the moment. I was an extraction ortho case. I was born with a deviated septum, and I couldn't breathe through my nose. This is in the 50s, right? Which they didn't fix, in those days. Um, and I couldn't nurse because it took me, if you can't breathe through your nose, it takes you a long time to eat, right?
Mm-hmm.
And so, yeah, my mom could nurse me, but it took me like 3 hours, like to nurse. And, she didn't have that kind of time. So put me on formula and a bottle. And the nipples on the bottles um, in the 50s looked like a thumb, right? And so literally I was already had a constricted palate because I wasn't squishing my tongue against a natural nipple and broadening my palate. So I ended up with this, constricted palate. Then in my first round of ortho, of course, they did extraction orthodontics, made it even smaller yet. I had anterior constriction, in my occlusion, still couldn't breathe through my nose. So I've been a mouth breather my entire life. And I finally just thought, and one of the things that we know about mouth breathing, we know it well now, the associated systemic effects of that is that it increases your blood pressure. And I've watched my blood pressure just slowly increase over my life to the point where, like 2 years ago, I had to start taking medication for it. And I don't like taking medication for anything, right? So I'm like, okay, let's see what's caused this and let's fix that. And so I'm opening spaces. I'm going to have my premolars put back with implants. I'm about not quite 2 years into this process, but I have room for my tongue. I just had the nasal surgery about 2 months ago. I can breathe through my nose.
That is so awesome.
And I got to tell you, it's life changing, right? But it's me, in my 60s correcting, the healthcare,
Lifetime.
but a lifetime of stuff. But my blood pressure is going down as I'm breathing through my nose, and I hope to get off the medication completely. So,
The
but
emotional part for me, and one of the reasons that I admire your work so much, and the work of Dr. Bradley Bale as well, is one, it's the message of it's never too late. Much like your patient in her 80s that decided to go ahead with the bridge. I had a really personal experience. So Dr. Kim Kutsch, for all our listeners, came and spoke at a PDA event in Cancun, Mexico a few years ago. My first time ever hearing Dr. Kutsch, and when you started going into the risk factors, it started to change my perception. I started to see things differently. And then Bradley Bale with the heart attack gene book got up. I just sat there and I had one of those moments like, this is going to change someone's life. And I went outside of the room, and I called someone extremely personally close to me and who had been struggling and felt like he was older, he'd had a good life and his health wasn't where it should be. He doesn't like taking medication, and he's fine with it, like being in the end. And so I got on the phone and I said, you can change this. You need to go to the doctor, but you can change, you can actually reverse it. It's not just living a flat line right now going forward. You can actually make it better. And it did. It changed his life, and he found out all sorts of things that he wouldn't have been. I don't think he would be here today had he not made that change. And so that's why I'm personally so passionate. And of course you would end up in that situation in your 60s saying, well, I guess I'm going to fix it now. But that's great, because it is
I
not
thought
too late.
it was really when I retired from clinical practice that I was like, you know what? I want me fixed now.
Take care of myself.
I took care of everybody else all these years, and I didn't have time to do this. And I'm going to live another 30 years, and I don't want to have to live this way for another 30 years, right? And so I can tell you the treatment wasn't necessarily fun, all of it. The nasal surgery was breathtaking, but I can breathe through my nose. I mean, and that's just been a life-changing experience for me. It's been really interesting.
Welcome to breathing, huh?
Yeah. Oh, it's amazing to me. And I can smell things that I've never been able to smell. I don't know. It's just crazy. But so it's never too late, right? I don't have. I'm sorry I waited. If I have any regrets, I regret that I waited this long to get this corrected. So, but it's going well, and like I say, I'm 2 years into it. But I had lost a tooth from a sports involved accident years ago, and so I had an implant, for tooth number 25. Well, implants don't move with ortho, so I had to have that taken out. So now I'm
Mm.
without tooth number 25, although I have a denture tooth in my Invisalign tray. But I can't eat with this, and so I have to take it out. And so I will be talking to somebody and forget that I don't have a tooth there, and like people are like, and when like the first year, I mean, I was embarrassed, like to like take it out and eat, have anybody see me without a front tooth. And then I thought, and I can't begin to tell you how crippling it is just to be missing one of the smallest teeth in the entire mouth, just one. And two things for me that were a revelation. Number one is how embarrassing and how much I
Yes.
think shame there's associated with that.
Yes.
And number two, how debilitating it is. Like I couldn't bite through a sandwich. I still can't. If I have it, I can't bite through a sandwich. I couldn't eat corn on the cob. I couldn't eat ribs. There were things I just went down. And it's like, I went to the restaurant. It's like, I'm used to ordering whatever I felt like that day. And it's like, okay, I got to be able to order what I can chew.
Right.
And I had and I thought to myself, God, I had all these patients all these years that were missing 10, 12, 15, 20 teeth. How did they possibly get by? Right? How did they do? I'm missing the one of this, and it's the smallest tooth in the mouth, and it's crippled me. And it's been those two experiences have been very humbling for me, So it's been interesting. So, but like I say, I only regret that I didn't do this a long time ago.
Yeah.
I think that was one of the first marketing campaigns I ever did 11 years ago for a PDA doctor. And it was a huge billboard, and it said, "How would you like to bite into a fresh ear of corn again?"
Oh yeah, right. Or I can't bite into an apple right now, right?
Yeah.
It's interesting. So, but anyway, so I'm in the process. I'm getting there, and it's one of these days I'm gonna be able to smile without Invisalign trays in,
And you will.
yeah, and I will. I'm looking forward to that day actually. But yeah, so that's kind of quite a bit about my history and dental caries and my interests and how this all came about.
Thank you for
We've
taking
gone full
time out of
circle,
your schedule and
Ah,
taking time to educate everyone. We're going to spread this podcast as far and wide as possible as we can, because it's such great information. And thank you for all that
well,
you've done and all you
oh
continue to
well,
do.
Yeah,
well,
it's cool to be able to personally thank you. I've not met you, other than through your book and stuff like that, which allows for you to be immortal, to be able to spread, that information beyond your speaking events or personally, telling someone about it. So it's really cool. I want you to even know, I have a patient. We went fee for service a couple years ago. Family decided to leave the practice. They still come in and buy the CTX rinse. They don't even come here anymore, but they don't value me that much, but they value my decision to sell CTX rinse. So because their family, they would come in every time. How many cavities? It wasn't, do they have cavities? How many cavities? And that's kind of uncommon for my area. I don't live in an area where it's just rampant and all the, so I live, I guess, socioeconomically in an area in Des Moines, Iowa, where, we don't have that. But they were. And as soon as they started the rinse, it stopped. And so they value it, and it's gold to them. So on behalf of them, thank you. And for me too, it's been empowering to let patients know, you can do something proactively.
mm-hmm.
And how cool is that to be able to talk risk factors, the way that Bruce talks about it, the way that, that Kois talks about it, and to be able to share those, ways, those modalities for people to choose health. And so thank you.
Yeah, well, Chad, and thank both of you, Chad and Reagan, for those kind comments. It's funny, I just read 2 articles in the last couple of weeks in the Wall Street Journal, and one was about that your most productive years are your 60s, and your second most productive years are your 70s. And I found that quite interesting. And then I'm working with another wellness coach, and she's kind of focused on trying to help people transition into the retirement mindset. And the greatest challenge for people when they retire is finding a purpose in life. It's not all the things that you would think it would be. It's finding purpose. And I would tell you that right now I feel like giving up clinical practice was kind of hard for me to do because I've done it for 40 years, and I saw myself as a dentist, first and foremost. But I really, so I'm not retired because I'm actually more involved now, on a day-to-day basis with CariFree, and I'm having more fun than I've ever had in my life. But I feel like I'm doing my best work right now, and fulfilling a purpose to help as many people who are suffering from this disease as to help as many people as possible. And it's opening up opportunities, even for doors are opening for me to help like cancer patients and people that I had never thought I'd be able to reach and touch and help. So thank you. It's been, like I say, I'm living my best life. I'm having so much fun. And it's so personally rewarding just to know that you're helping people.
That's right. Well, thanks for doing that.
Yeah, Chad and Reagan, and thank you guys for having me on today. And I don't know if we talked about all the things that you want to talk about or not, but I enjoyed it. And
sometimes when I'm hungry, I go in expecting to want to eat 4 appetizers and 3 desserts and everything like that. But when you get done with the meal and you realize you're satisfied, you need to stop. So. Okay. Thank you. Yeah. In other words, yes, I could keep you hostage for talking a lot of nerdy stuff, but I'm going to say, you know what? You've had 2 desserts and 3 appetizers already. You're full. I'm full.
Cool. I've seen you eat 3 desserts.
I do.
Real fact.
No shame. I'm not making, those numbers aren't arbitrary.
It's a good thing you're using the rinse, Chad. That's all I can say.
Pretty much. And it's amazing I'm not 400 pounds, but whatever.
So let's, I'd love to come back sometime too in the future. So I've got a couple of other new projects I'm working on when the time comes to help other people. I'd love to come back and spend more time with you guys. Thank you so much for your podcast, because getting all this kind of information out, like this is the missing link, is we have all this knowledge. We have to share it with people.
Yes.
Well, thank you, Dr. Kutsch, so much. And people, if you want to check out CariFree, it's just carifree.com, right?
Yep.
CariFree.com, and we will have CariFree at the productivity workshop this coming September. So CariFree will be there and speaking during our advanced clinical hygiene breakout session. So that's another great opportunity as well.
All right, guys.
Thank you. All right.
Everybody live your best life.
Thank you for listening to another episode of Everyday Practices Podcast. Chad and I are here every week thanks to our community of listeners just like you, and we'd love your help. It would mean the world if you can help spread the word by sharing this episode with a fellow dentist and leave us a review on iTunes or Spotify. Do you have an extraordinary story you'd like to share or feedback on how we can make this podcast even more awesome? Drop us an email at podcast@productivedentist.com. And don't forget to check out our other podcasts from Productive Dentist Academy at productivedentist.com/podcasts. See you next week.